Good evening, my name is Diana. I will be the nurse and the patient teaching in prevention of diabetic foot ulcers using foot inspection. What the resources that I'll be using is brought by Taking Care of Your Feet from American Diabetes Association. The other item that I'll be using to help is a handheld mirror. So when I come in, the perfect time to teach this would probably be after the patient is going to be either discharged, or if this is going to be in a home health care setting after wound care. I would think these would be the best times. If not, you can verbalize teaching when you're doing wound care at the hospital, and just say after you clean it and everything, the patient's calmed down from all the cleaning, you can just be like, one way to look for this in the future is seeing open areas, signs of redness, cracked toes, and the best way to look for it is using a mirror or having a friend or a family member inspect your feet. So what I would do is teach my patient like this. Sit in a chair or in bed, wherever you are, your most comfortable state. And if you're at home alone and you're able to lift up your leg, lift it up and just look at the bottom of your foot. If you can't really lift it up too high and it's just really uncomfortable, use the mirror. Look at the bottom of your foot and see if there's anything. Best time if it's at home, after a shower or before bed. If you're at a hospital, after the cleaning of the wound, or just demonstrate even if there's a bandage over it, and just be like, show the bottom of your foot. And since I would be the friend or the caregiver at the hospital, I can inspect their foot or the other one to see if there's any breakage. So that would be one way if I'm at home or at the hospital. Another one is having their friends or themselves look between their toes to see if there's any sign of redness or breakage, the bottom of the heels, and sometimes even their bottoms, just to see, just in case. The resources that I use to help in providing proper foot care and prevention is I used it from Taking Care of Your Feet, which is from the American Diabetes Association. And another thing, if the patient is at home and they're unable to look at their foot or they're unable to get a caregiver, have them use the mirror and put it on the floor, very careful, and then have their foot over it with a well-lit room and just look at it. Turn your foot around as much as you can. Try to open the toes as best as you can and look at the bottom of your foot, especially on the heel. If there's any sign of redness or something that you might be questionable and you have nobody else to look, you call your doctor and see if maybe him or her can check right away, because you don't want to end up with an ulcer. And that is my video. Thank you.